My topic is From Trauma to Herniation, Sequential OCT Documentation of Macular Hole. Coming to its introduction, it is a full thickness defect in the foveal region of the retina that develops after blunt or penetrating ocular trauma. They are caused by sudden mechanical forces on the globe, and patient will present with decreased central vision, central scotoma and metamorphopsia. Usually these patients are observed and closely followed for spontaneous closure is done. If hole persists and with significant vision loss, then we can go for surgical treatment like pars plana vitrectomy with ILM peeling and gas tamponade. This presentation will highlight a case of an 11-year-old male patient who was diagnosed with traumatic macular hole, its sequential OCT and its fate of the macular hole. So the boy presented to the hospital with diminution of vision following a cracker injury 1 week before in right eye. On examining the right eye, best corrected visual acuity was 20 by 120. And anterior segment findings were within a normal limit. Coming to the posterior segment of the right eye, we could see media being relatively clear, blurred disc margins are present, and vessels are arising from the center being mildly dilated. Coming to the macula posterior pole, we could see Berlin's edema, and incomplete macular star appearance is present with small macular hole is there, which can be confirmed with OCT macula, and also PRH is present superotemporally. So OCT macula was done, and we could see hyperreflective echos at the VR interface, which is suggestive of dispersed VH, and a full thickness macular hole is present with subretinal fluid. On OCT of the disc, we could see elevated disc margins, which is suggestive of disc edema. So this patient was observed and closely follow-up was done, and patient was called on second week. On second week of presentation, the OCT macula revealed hyperreflective spots were still present, suggestive of an dispersed VH. There was retinal thickening with an hyperreflective membrane present over, which is the ERM. So again the patient was called at 1 month, and OCT revealed reduced hyperreflective spots, marked retinal thickening with inner retinal layer protrusion over the ERM, which is suggestive of the foveal herniation. At second month from the presentation, patient was again called, and the OCT revealed worsening of that foveal herniation. At third month, we could see worsening on the OCT, and the fundus photos revealed there was glial proliferation tissue around the optic disc margin, suggestive of the resolving disc edema, and in the vessels are being mildly dilated and tortuous. In the posterior pole, we could appreciate the glial tissue proliferation and the macular content protruding out. Inferiorly, we could also see the exudation present. So, as there was no any significant improvement in the visual acuity over the 3 months, and we could see the worsening of the OCT, VR intervention was planned, like pars plana vitrectomy with ERM and ILM peeling with gas tamponade was planned for the patient. But as patient's parents were not willing for the surgery, thus the patient lost for the follow-up. So, as we know, traumatic macular hole is usually rare in children, but it is vision threatening, often follows blunt trauma, and usually present with central vision loss, scotoma, metamorphopsia. Children show higher spontaneous closure rate, that is within 3 to 6 months, due to strong vitreoretinal adhesion and better healing potential. Hence, for this case also observation with OCT monitoring was done. But as there was no any significant visual improvement and worsening of OCT changes would be seen, so surgery was planned for this patient. So the conclusion of my presentation is macular hole and ERM in young individual is uncommon occurrence, with trauma being prevalent case in this age group. Close monitoring is crucial for the spontaneous hole closure and ERM, as ERM tends to progress rapidly in younger patients compared to adults. Thus, early diagnosis, close monitoring and timely intervention are crucial for achieving optimal visual outcomes.